What is cancer? It sounds like a simple question, but the answer is far from straightforward. Cancer, in the most basic terms, is the uncontrolled growth of abnormal cells in the body. It's not a single disease, but a collection of over 200 different conditions. Each type of cancer has its own unique characteristics, but they all share this common trait: unregulated cell growth. Imagine cells as tiny factories, each with a specific role to play in the body. Normally, our body controls the production of these factories, creating new ones only when needed. But in the case of cancer, this system goes haywire. The factories start multiplying without any checks and balances, leading to the formation of a mass or a tumor. Now, not all tumors are cancerous. Those that are not, we call benign tumors. They might cause problems depending on their location, but they don't spread to other parts of their body. The ones that can invade nearby tissues and spread to other parts of the body, however, we call malignant. These malignant tumors are what we typically refer to when we talk about cancer. Cancer can be categorized into 5 main types: carcinomas, sarcomas, leukemias, lymphomas, and central nervous system cancers. Carcinomas, the most common type, start in the skin or tissues that line the internal organs. Sarcomas develop in the bone, cartilage, fat, muscle, or other connective tissues. Leukemias begin in the bone marrow and cause large numbers of abnormal blood cells to be produced and enter the bloodstream. Lymphomas start in the cells of the immune system. And central nervous system cancers begin in the tissues of the brain and spinal cord. Diagnosing cancer often involves a series of steps. It may start with a simple physical exam or a discussion about personal health history. If a doctor suspects cancer, they might order certain tests, like blood tests or imaging tests like X-rays, kinetic scans, or MRIs. In many cases, the only surefire way to diagnose cancer is through a biopsy, where a small sample of tissue is removed and examined under a microscope. Once a cancer diagnosis is confirmed, the next step is to determine the stage of the disease. Staging helps doctors understand how much cancer is in the body and where it's located. This information is crucial in planning the most effective treatment strategy. Cancer management can be complex, as it often involves a combination of therapies tailored to the individual's needs: surgery, radiation therapy, chemotherapy, immunotherapy, targeted therapy, hormone therapy, stem cell transplant, precision medicine. These are just some of the options in the cancer treatment toolbox. The choice of treatment depends on the type and stage of cancer, potential side effects, and the patient's overall health. In conclusion, cancer is a complex group of diseases characterized by uncontrolled growth of abnormal cells. It can occur in various forms, each with its own set of characteristics. Diagnosis usually involves physical exams, tests, and biopsies. Once diagnosed, the stage of cancer is determined to plan the most effective treatment strategy. With a multitude of treatment options available, cancer management is tailored to the individual's needs. Despite the complexity, understanding the basics of what cancer is, how it's diagnosed, and how it's managed can demystify this disease and empower those affected by it.